Hi, everybody. Welcome. My name is Kealy Spring. I'm a licensed marriage and family therapist in the state of California. I'm also a leadership and executive coach. But today we are talking about therapy, and I'm excited to introduce Kristin, who was actually one of my professors in university when I got my master's degree, taught me my first intro to CBT, which is something I use every day in my practice. So without further ado, I want to turn it over to Kristen to kind of introduce herself and maybe share kind of how you practice, what your niches are, populations you work with.
Yeah, great. Thanks, Kelly. I really appreciate this. I think this is a great idea that you're doing. This is serious, and I appreciate being a part of it. So, yeah, my name is Kristin Dempsey. I'm a marriage and family therapist and a licensed professional clinical counselor in California. And I actually practice out of San Francisco. So I have a private practice. Have a couple offices. I'm in San Francisco and Burlingame, and I do telehealth and in person. I also do a lot of training and evidence-based practice, mostly around motivational interviewing, but I do other things like trauma-informed care and various components of cognitive behavioral therapies and suicide prevention intervention, probably among other things, but those are kind of my main areas. And um, I also teach. So as you mentioned, I teach at San Francisco State and at the Wright Institute. So I do a lot of different things. And I'm writing right now. I just have a workbook on harm reduction and addiction that came out last year at this time. And I'm involved in a couple of other recovery and practice-based books that I'm in process. And yeah, so the way I work, a little bit about the way I work, I do use a lot of cognitive behavioral therapies. I kind of identify as a behavioral humanist or humanist behaviorist. I don't know how you would definitely phrase that, but I do a lot of engagement work and a lot of client-centered work, like using motivational interviewing to help people become engaged and be deeply listened to when I first work with them. But I also work very dialectically, where I'm kind of process oriented. So once someone is engaged in the work, I also then think about where they might benefit from tools. So when it comes to the actual more directive aspect of my work, I tend to use a lot of acceptance and commitment therapy to increase psychological flexibility. And I am very thoughtful every time I work with someone about what the balance of that is. Is someone needing to be more deeply listened to today, or is it more about skill building and to be able to hopefully seamlessly kind of move back and forth between those two dialectics, if you will?
Hmm. Yeah. And with your book, Harm Reduction, that's a term that not everybody is familiar with. Would you mind kind of sharing just a little bit of what that is?
Yeah, harm reduction is really exactly what it says. It's really anything um, that we were doing practically, but it's also a philosophy around engaging folks around just being safer in their behaviors, whatever that might be. So we're thinking of it in this particular way around substance use issues or potential other behaviors where there might be some harm. And whereas, say, like substance use disorder treatment has historically been around um, drugs and dealing with drug use, harm reduction is more around reducing the harms associated with drug use or the behavior. So it's not so concerned exactly in like the drug, so to speak. It's more about people being safe and about taking care of folks and helping them, um, go down a path of wellness that could look really different depending on people's needs. So it's a it's including a lot of things. It's a lot of different ways of working, and it's a lot of different types of responses, and it's being very flexible. And it's not like just abstinence, although abstinence is a great part of like harm reduction potentially. If someone chooses that, it's only one among many things that we might help people choose. So there's lots of choice involved that help them reduce harm.
Hmm. Yeah, thank you. And that you said it's a workbook that you just
It
published?
is a workbook. Mhm.
Right.
Yes, it's a harm reduction workbook for addiction. And it came out last year. It's with New Harbinger.
Okay, great. Uh, and so before we kind of dive into the questions I ask everybody, because Kristen, you've seen a lot of trends,
Mhm.
I'm imagining a lot of kind of ways in which this field has evolved and changed over the years. Would you mind speaking a little bit to kind of what you've seen, in your kind of journey here with this kind of clinical work.
Yeah, in terms of like how people are practicing.
I think a little bit. I mean, you train people like me to become clinicians,
Mhm,
right? So
mhm.
I do think you see how people are kind of training and those things, as well as just kind of general trends. I think, the ways in which people were licensed is different now than it was. There's
Yeah.
several aspects there.
Well, it's a really interesting question because in some ways, it's like some things are pretty constant in terms of just like the licensing process and how people collect hours and kind of the ways that we kind of jump through the hoops and training become skilled in some particular ways. And there's a lot of us, going through universities, we have certain requirements that have remained very similar over the years, and with some small changes here and there. And then um, the larger world itself has really changed, and I think there's a number of different things I think I could address here. One is just kind of our healthcare system in general, which this situation where people don't have like guaranteed healthcare, and that healthcare is often really challenging to obtain. So there's been certainly the Affordable Care Act, which has certainly brought more people in touch with healthcare potentially, but just actually obtaining providers and then obtaining the kind of support that you need from providers, like that has become in many ways like increasingly more difficult. And even though we have like mental health parity that's involved in a lot of these things, like that's become again increasingly I guess difficult to access. You keep thinking that there's going to be, and there's been more movement around having behavioral health, mental health be a part of people's packages of healthcare, but it's not always happening, right? It's like this, despite legal efforts, there's places where there's a lot of misses. So I guess what I'm saying is one of the things I'm certainly seeing is like there's more and more people training, and there's a lot of us out there, but it's still not always easy to help connect folks to healthcare in any ways that, including mental health care, that really meets the need. So I see a lot of therapists in training like trying to figure that out. Like, how can I do the work I want to do and really be able to respond and help so many people in the community, maybe even work in a social justice kind of way, and trying to distribute my efforts and my skills amongst as many communities as possible, but also sustain myself. And I think that's a real trying piece that we see. And I see a lot of creativity around that. Um, and I still see a lot of providers working in a lot of different environments, whether it's community mental health or private practice or kind of like your larger systems that might be like, the larger like healthcare systems like HMOs and such. And so we're out there and people are doing like really wonderful work. And I think bringing in more of the social justice issues, that's been a much of a trend in the last 30 years that I've been out here, which is hopefully not just a trend, but actually the way we're practicing now, where we're being more integrative and more contextual and understanding like social justice pieces. But it's there's still that piece of some folks who are often really struggling. It's still hard to get care to them, and so we have these big problems, but we're also doing so much differently in a way that I think is really progressive. So it's both of these realities are true at the same time.
Hmm. Kind of finding that balance between the two. And from a perspective of some of the, you work in a lot of evidence-based practices. Do you find that those, because when I remember when I was going through, there was a little bit more emphasis. I had clinical supervisors, for example, that were much more psychodynamic, and there was kind of a different model of, it felt like it was shifting. Are you seeing kind of evidence-based be more, widely recognized, over the years as you practicing?
Yeah, and I'm still, I'm so in like various models that are really evidence-based oriented, and that payers and people in the community are who are looking for evidence base, like they find me and I find them. So I am definitely part of that community, the evidence-based practice community, and I definitely have people out there eager to obtain the skills or to receive whatever services I have using the skills. because they're reading about it and it's becoming more mainstream in some ways. So I'll help folks who maybe they would know things like about motivational interviewing or about ACT or what have you, and they're calling me or they're reading about it. They want more of that.
Mhm.
And again, there's also some like employee assistance programs and other treatment kind of communities that like we want people here. We want folks to do evidence-based practices. And some of the places where I'm doing training and teaching is like there's agencies like they have money to train their staff, but it has to be an evidence-based practice.
Mhm.
So yes, so in that regard, definitely there's a lot more kind of interest and recognition and actual support of evidence-based practices.
Mhm.
And then there's also an important piece out here too, I think, of just what we're learning and thinking about in terms of like process and just what are some of the like the common factors, regardless of different approaches that seem to work with folks, and the ability to work with people in a way that's deeply meaningful and sees them. And I think again, a lot of our psychodynamic work definitely has that covered, uh, while also helping people develop tools for that they need, right? And there's always kind of a mix of things that might work for people in different ways. So I think maybe we're approaching a situation where we might have more unification around different ways of working.
Mhm.
That we're just looking at what are some of the common factors that seem to work and just like how to use what works when it's needed. As
Mhm.
hopefully I think will be maybe a trend that we'll be seeing.
Mhm. Rather than a one size fits all or kind of a box, more of a blending of all the different styles and techniques to kind of.
Yeah, having toolkits of things that you work you can kind of use that you just have a lot, there's a lot of stuff out there that's been researched, at the level of intervention and how to really think about putting those things together that still, have like good effect size that seem to really be doing what we need it to be doing. But that we can use flexibly and
Sure.
thoughtfully. Yeah.
Yeah. Okay, so let me kind of go back to some of the other questions I like to ask
Yeah.
this. But I appreciate you answering that. I think you have a unique perspective there, just kind of given your expertise in the field at this point. Um, what was your journey? How did you decide to become a clinician?
Yeah. So yeah, thanks for asking that. So well, it was getting to be a long time now. So I started off in my undergrad program, I was kind of a liberal arts person and I was interested in lots of social justice work. And I was working at the time around reproductive rights. And as you can imagine, I'm still doing some work in that area. But this is back in the 80s. So things I was working on were like, um, anti-war work around Central America at the time. And that was an important piece. The reproductive rights work and anti-apartheid work. I mean, these are all things that we're working on. And I was interested in like, what am I going to do for a career? And interested in doing something that seemed important and social justice oriented. And it's very much from like a working class background of just like, if you're going to go to college and you need to come out and be able to do something, right? That was important to like family value and an expectation. And so I was a women's studies major, and back in the program I was in San Francisco State, we would actually be counseled and advised, like, okay, you're going to be a women's studies major. It's fantastic. What do you want to do? Do you want to do research and development and social work? All these different aspects. So I kind of went down this path of, well, I am interested in doing some aspect of like direct intervention, direct support, and so. That's where I decided to go into the counseling program at San Francisco State. I had friends who were in the program, so they're very influential. And I started to do internships even as a undergrad, as a women's studies major. And I was working in domestic violence as part of that and became just really even much more engaged in the work and how important and powerful it was. And so that's how I got started. I was working at San Francisco State. I worked in family planning for a couple of years in between as I developed some counseling skills in order to apply and get into the program. And then, one thing led to another. As I went through the program, I got involved in schoolwork and decided to specialize in um, schools, but also really in substance use disorder treatment. And I was fortunate enough to work at an agency that really focused on family therapy kind of the systems work
Mm.
in the context of substance use treatment. So I got to do family work and couples work and groups and individuals, like all kinds of training with alcohol and drug issues being a part of that. And that was such a great comprehensive training. And from there, I got very interested in co-occurring mental health and substance use issues. I partnered with someone from our community mental health, county mental health, and um, they let me know of some work that was opening up on that team in the county mental health setting. So I spent another dozen years in San Mateo County. And in that area of doing the co-occurring, we call them co-occurring conditions now. It used to be called dual diagnosis back in the day. I really found that to be a great specialty. I still specialize some of that in my practice, my private practice. And I didn't actually answer that earlier. So I've really stayed with the substance use disorder treatment, even though I do a lot of generalist kind of work in my practice as well. And in San Mateo County, I also started to do work that was more systems oriented in terms of um, like systems change kind of work, things that are a bit more around, planning and leadership and kind of change agentry, so to speak, and helped integrate the mental health and substance use disorder programs, which is a lot of work. Doesn't sound like much on paper, but it's just a lot of work integrating policy and practice and cultures and such. And from there, from San Mateo County, I went into, because I became very involved in the motivational interviewing and training. Then I started to work for a community, like a statewide organization that did training all throughout California and evidence-based practices. So I would
Hmm.
do that work, and then from there, I left and kind of developed more of my own practice and started my own organization in terms of practice and training, which I've been doing for about 10 years now. And of course, all along there, I've been teaching. So I've been teaching at the graduate level, either adjunct or core faculty for about, oh gosh, it's getting to be a while now. So it's getting to be, I think, almost 20 years. We're rolling on 20 years almost. So a long time teaching as well.
Yeah, quite the journey.
I had
Quite
to
the
really think about, I know so many things. Like I know there's lots of stuff I probably forgot along the way, but that's an overview.
fair. It's hard to condense all that into, a couple minutes.
Right. I'll remember at 3 a.m. this morning. Oh, wait, there's something else, but lots of different things.
Fair, fair. So you did talk about kind of the modalities. We've been kind of talking about that of what you work with. But what would a typical session look like? I think you kind of spoke a little bit to this, but
Yeah.
if we were to come see you, what does that look like?
Yeah. So first of all, I do always start with the kind of the listening that we really promote, like a motivational interviewing, which always sounds like so basic. Like, of course, anyone would do that, but it's not always easy to do, especially if someone's coming with like a fair amount of complexity. And I think any of us as clinicians too can be really activated by wanting to help someone do something different or trying to, have a certain outcome or have someone move in a certain direction. So to be able to pause and just listen and be really curious about, hey, what's happening for you? What kinds of things are going on? Especially with someone's coming and they are there because they've been mandated or, voluntold, as I like to say. That can be really tough for us, I think, to stay away from like the outcome. Like I
Sure,
have to get someone to do something, and it's like I can't get anyone to do anything. So
sure.
I do a lot of talking and training around this particular topic of how to just stop and pause and be curious and just listen. It's really sounds easier than it often is, but it's such a powerful piece. And so there's a lot of listening, and I also set someone up for a situation of how I work, which is listen, I listen deeply, but I also will help you focus. That's one of the goals, one of the ideas, driving ideas around motivational interviewing as well. So we can help think about very intentionally like what you want to focus on, which can change, but we want you to have direction because you come in and it's just like, I don't know, I kind of have these themes or whatever, but I want people to be really clear like what we're working on. And then when we're choosing that, of course, everything I do, I try to collaborate around. Like even if I give advice, I ask permission before I give advice because um, I've heard someone say advice is like the junk mail of life. It's like it's so easy to over give advice. I think might be great if someone's like, I don't really want that. So just this ability to step back and really be thoughtful about, do you even want what I have here? you're so in charge. So it's this process of guiding and helping folks stay really focused while also allowing for lots of collaboration and flexibility. And then I also tell people, even the first session, like as we're thinking about where you want to go, because sometimes people know right away, but a lot of times people don't, or even as someone thinks they know where they want, but as we talk, more things come up. And it's like I explain all that, like this is like normal. That's all of this is normal. Anyone can have all kinds of responses. But as we do this, I am going to work with you about what kinds of things might be helpful for you. And here's where I get into some of the psychological flexibility pieces around ACT. Like there's things that we can do to help build into your ability to be in the present moment, take perspective, have acceptance, be able to, um, be present, kind of unhook from really difficult thoughts, in order to move towards and to engage in like things that you care about. So I work a lot with values and help people think about like whatever goals, whatever we have on that treatment plan, like is it helping you move towards the things that you care about? Is it helping you move towards like a life of vitality for you, whatever you define vitality as? And I find that many folks like really connect with this, even if it takes a bit to kind of sort some things out, like this idea of like we're on a journey somewhere that's meaningful to me, to me if I'm from their perspective. And there's signs and symptoms and things that I might have come in with. And it's like, okay, we have that. And we'll put that in the context to kind of understand, like, this probably makes perfect sense why you have some of the concerns that you have, some of the symptoms that you have in this particular context. But just focusing on the diagnosis itself, it may or may not be as of use, but really helping you think about like where you want to go in different ways of being able to do things and to think about things and experience things. Like often that's what really helps people feel this sense of relief because they're moving towards what they care about.
Mm-hmm.
So that's generally the way I work. And then I can have like lots of different ways of doing that. Sometimes it's more structure or less structure, depending on how the person is showing up in terms of their own ability to kind of function and be in the world. So I work with folks. I talked about the co-occurring conditions. So sometimes a lot of complexity there. I work with folks who might be experiencing what's standardly called like psychosis, but often we'll call it like engagement in non-consensus reality, and like it sometimes they come in because someone's had them come in, like the family member, let's say, and they may not even necessarily want to be there. So it's really helping people engage with like what's meaningful for you now and how it can be of service. I have lots of people with substance use. I work with adolescents and children. So sometimes they come in with like different ideas about like, why should I be here? Who wants me here? So I'm really trying to find ways of engaging that's meaningful for whoever it is I'm working with. So it takes a lot of flexibility on my end to do
Mm-hmm.
that, which I love.
Yeah. Yeah, it's really kind of pulling from wherever you need to kind of pull to, kind of do the work that's needed in the room with that person. And I love the
Yeah.
junk email.
Right, right. Got that from a colleague of
Definitely
mine.
gonna use
Yeah.
that.
Yeah.
Okay. So, is there anything that surprises you about therapy? I mean, you've had quite the journey. Is there anything that still surprises you?
Well, that's kind of an interesting thing. Yeah, just get a little kind of meta here, maybe in a way, which is what surprises me is the fact that there's still always something to learn.
Yeah.
Like, I never get the sense of like, oh, I totally got this. I definitely feel much more comfortable in my work and how I work and some challenging situations. But there's times too when I'm certainly thrown off my center, and there's times where it's like, oh my gosh, I shouldn't be doing things like that, or here's something new, or I haven't really thought about it that way. So there's always something to learn. And that's why I've really loved the work so much, is like never stop learning. I was thinking about this today. It's at the beginning of a new spring semester, and I got something on LinkedIn that reminded me that I've been working at San Francisco State for 14 years or something like that. It's a long time. And I was just thinking, I was out for a jog this morning. I teach, the course is still called addiction, but it's like the substance use disorder treatment course. And I was out jogging and thinking, wow, like when I first started to teach this course, it was so different than the way I teach it now. And how I'm teaching and like just even the media that I show and such, it's very, very different and so much less judgmental. Like not like I was ever intending to be judgmental, but just like the way we talk and think about people who use substances, it's really shifted. I think for the better, but it shocked me. Like, wow, I can't believe I used to show that video, or just some of the things. And so that's I think the thing that still surprises me is how much I continue to learn and learn about myself.
Hmm. Yeah. So Kristen, I know we've got like 3 more minutes here. Would you like me to ask you one more question
Sure,
or yeah,
we
okay.
do that. Yeah.
Um, so what do you wish people knew about therapy or
Um,
understood about it?
yeah. So with it's a really great question. I think the thing I'd like them to know about it is that uh, it's probably not going to be exactly what you think it is, but also that therapy um, could be and should be something that can be really highly individualized, and that it's more about someone hopefully working with you in a way. I know there's different ways that therapists work, of course, but like someone asked me about how I work, at least it's more about someone working with you in a way that's facilitative and uh, not so much about restructuring you. Because I definitely think there's this thought, and I still have folks coming in, or often I have people I'm talking to who may not even be interested in therapy, but it just might like be at a party or whatever, about this idea of like therapist going in to fix me, or this idea of like I'm broken, or and I really try to address kind of those thoughts like really quickly in the work where it's like I see myself more as someone who like facilitates people's process, and that like my work is about being really attentive and being really thoughtful about how to pull out the best in folks. And that I wish people also knew that they have what they need. And it may not be obvious right now. And that's understandable because if it was, people would just be feeling great all the time. But that in a therapy relationship, like this facilitative piece, where it's not about you being fixed, it's about us becoming really aware of like what you have and how to use it. And I wish people knew that because I think that might certainly make therapy more enticing, maybe less threatening, more more engaging, and potentially more empowering. I mean, people can get in touch with their own power.
For sure.
So I think that's what I'd want folks to know.
Love it. Well, thank you, Kristen, for
Great.
taking the time.
Yeah, thank you. Anytime. This was great. I really appreciate it. I love that you're doing this.
Thanks. Thanks. I
Yeah,
really
great.
appreciate your time. Thank you so much.
Yeah, it's great. It's great seeing you. Thanks for asking me to do this.
Yeah, for sure. All right.
Thanks.